So I am by trade a surgeon, a trauma surgeon, and a surgical intensivist. That's what I did for a lot of my professional life. Got very interested in quality and safety, joined the Memorial Hermann program in 2007 as the Chief Quality Officer, and fairly quickly thereafter became the system's Chief Medical Officer, and then earlier this year became the Chief Clinical Officer. My main job is to improve the quality, safety, and value of care for the patients that we serve in the greater Houston area. Well, telemedicine is playing an increasing role literally every month in the care of our patients. For one, it's improving access. So we now have an application which we call Schedule Now, which patients or their families can access on computers or phones or tablets so that they schedule themselves for physician visits, schedule themselves for, if they need or have a prescription for a diagnostic test, they can schedule it at the most convenient imaging location or other care location, and they can do that themselves. We have a home care application that we call Virtual Care Check, and is a system that we operate that provides patients who need it, patients with chronic health conditions, heart failure, diabetes, and the like, with a tablet type system at home. Of course, it only has a single application on it, our Virtual Care Check application, and it communicates wirelessly with blood pressure measuring devices, pulse oximeters, glucometers, and scales, so that patients can report in daily their vital signs and other parameters. It also has a video two-way link, and we install this. It runs off a 4G cellular network. We test all that out. We don't require anything of the patient's home networking or anything like that. So we provide all that. So there's two-way interfacing with our nurses, and we actually measure the patient's compliance with that. And compliance has been very high. The system doesn't work if the patients don't report in their parameters. So if they miss more than a day, one of our nurses will give them a call, but usually we're expecting them to feed in their results each day. If there's anything significantly abnormal, the system automatically pages one of our nurses, and we get on the two-way link with them, or we call them on the phone so we find out what's going on. Our compliance is around 90%, so it's really very, very good. Patients love this system because it puts, without them leaving their home, it puts them in touch with care providers. And in some cases, patients' families have asked for the patients to be on this or stay on this because they have the reassurance that their parents, say, are now being monitored in a way that really wasn't possible before. There was a capital outlay for the devices, and when I said there are nurses who are looking at the data, there's a cost of those nurses and those social workers, who are following up. But we did analyze, we've had the system for about 2 years. We analyzed the first 199 patients that we had on the system. Amazingly enough, the cost of their care for their use, which is about 90 days, was just under $750. That's a portion of the cost of acquiring the equipment, which is used, of course, for many patients, a portion of the cost of the personnel involved, and the wireless. We have to pay the wireless company for the 4G, and so on. So there are expenses, but per patient per 90 days, it was a little less than $750. The cost of the patient's use of the equipment and the nurses and the wireless service, et cetera, for their 90 days was just under $750. But on those patients, we saved over $1.5 million from their baseline cost before we started using this home care system. So we drastically reduced their number of hospital admissions and observation unit admissions, 60–70%. Overall, including the cost of the equipment and the personnel, we still saved about $1.5 million. So we provided better care with fewer hospitalizations at a much lower cost. That's what good health care is all about.